thank everyone for coming out this afternoon in this beautiful warm weather in the hot Atlanta for sure today. And what I want to do is make sure the population at large, and you in particular, know some very vital information that can save y'all years and add life to your years and years to your lives. What we're doing is a series of lectures on heart and artery disease. We'll be offering lectures on many different subjects, from diabetes, liver disease, all these types of things, and obesity, that type of thing, bowel cleansing. All those things are coming up, so look in the computers and the handouts for it. My name is Dr. William Richardson, and I have started the American Clinics for Preventive Medicine. And of course, we're very much interested in preventing illness and also treating it. Now, I look at it from a preventive aspect. You can have primary prevention, which is in our children, especially preventing them from getting any type of particular problem. Then there's secondary prevention, which means, you know, you go to health fairs and you look for high cholesterol, you look for high blood pressure, and then you treat it before you get a secondary disease like heart disease or stroke or kidney disease. Then there's tertiary prevention, which is, let's say you have had a heart attack, or you have kidney disease, or you have had a stroke, cerebrovascular disease. Then we work on you to prevent further occurrence, and we work for reversal. So, of course, we're going to have a theme here. Heart disease is reversible and treatable. Specifically, we're talking about coronary artery disease, which is the most, by far, common heart disease here in the U.S. And that, of course, is where the hardening of the arteries occurs in the arteries that feed the heart the nutrition and oxygen it requires to function every day, day in and day out for your whole life. And some of the statistics are really, really alarming in heart disease in general. About 80 to 90,000 people are affected in the United States. About 73,000 people have high blood pressure. And most people who have high blood pressure do not know they have it. Most people who know they have it are not being treated. And most people who are being treated are not being treated adequately. So that's pretty bad. So, and if I said 1,000, I meant 73 million people, 73 million people have high blood pressure. 16 million people that we know of have coronary heart disease. And I'll prove to you that that's dead wrong. In fact, I'll show you in a minute how 85% of Americans in their 50s have coronary heart disease and don't know it. 85%. And that article you have is going to show you that. But specifically, almost 9 million people get a heart attack, and about 9 million more just get that chest pain, and it doesn't quite go over to a heart attack. About 6 million people get a stroke every year. And heart failure, that's when the heart can't pump the fluid out of itself well enough and it backs up into the lungs, and you have water on the lungs, and you go to the hospital, get a shot of Lasix, and you urinate a lot, and then you get relief. That's heart failure. That's left-sided heart failure. And that's about 5.5 million people per year. So that's a lot of people we're talking about here. And we all can be affected. The article that I gave you is a very eye-opening article. And as an introduction, I want to go over this article just to let you know what's really going on. And when you understand this article, you're going to understand more than a lot of medical doctors do. So pay attention. Yeah. Okay, now you know how when people get let's say a heart attack, or they have very severe pain and you suspect they have heart disease, they may go to a bigger hospital, because I work in emergency rooms and we can send them to bigger hospitals, and they get an angiogram. Angio means vessel, and gram means you can come and have a seat, it's no problem. Gram means to visualize it. Okay, so angiogram is visualization of the vessel. And the way it's done, a catheter is inserted into the femoral artery, and you shoot dye backwards into the heart. Okay? And
ATT?
this talks about is that conventional angiography fails to visualize 95 to 99% of atherosclerotic plaque. Athero means of the artery, sclero means hard. So hardness of the artery, plaque. This is a doctor of clinical cardiology, Dr. Stephen Nissen, N-I-S-S-E-N, and he was giving a talk at the American Association of Clinical Endocrinologists. The endocrine system is the glandular system, so these were doctors who study the glands, and he was giving a talk there. And it was shocking when I saw this, because I always thought this, and now it's on paper. 95 to 99% of hardening of the arteries is missed by heart specialists. Massive atheromas, which are streaks of fatty infiltrates in the arteries. Can you hand this to her in the back? Massive atheromas lurk within the vascular wall, outside the view of angiography, because what they're doing, they're shooting dye into the artery, and they're saying that most of the plaque is in the outer walls, and you'll see that. Massive atheromas lurking within the vascular wall, not in the lumen. Now the lumen is where the blood actually flows. So this is the wall here. If you look at a cross section of the artery, and the lumen is the inside. And what they look for when they shoot dye in, they look for some plaque like that they can actually bypass. And what this gentleman is saying is that most of the plaque is in the walls of the artery, not in the lumen. Okay? And these particular lesions account for 2/3 of heart attacks and hemodynamically insignificant stenosis. Wow, what does that mean? To be stenosed means to be tight. Osis means too much tightness. Insignificant means that they can't bypass it and make that $130,000 real quick. Okay? Hemodynamically means blood flow. So it means that the blood appears to flow effortlessly, because it's hemodynamically insignificant stenosis or tightness. So what he says, this is a painful lesson for my colleagues in interventional cardiology. Interventional means do something, stick a catheter and open it up with a balloon, intervene. And this is a painful lesson. They don't like to be told they're looking at the wrong endpoint when they give patients with a normal angiogram a clean bill of health. Isn't that interesting? Excuse me?
Tim Russell.
Yeah, that's right. So to demonstrate, he showed apparently normal angiograms of a particular artery, and then they did a new type of test called intravascular ultrasound. Now, the intra part means it's within the vessel. Vascular, intravascular, in the vessel, ultrasound. So they send sound waves to check the thickness of the artery wall. And they were able to demonstrate in arteries that they shot dye in, they looked normal, but when you did the intra-arterial or intravascular ultrasound, it showed massive plaque all around the arteries. So that's what he did. And he also said the angiographic model of coronary artery disease, that's the model that they're still using in all the major institutions, is dead wrong. As soon as I saw this, I called some of my cardiology associates or acquaintances, let's say, and they said, oh yeah, we know about that test. It costs an extra $1,000 to do it. We don't do it. I said, oh, okay. So that's what they're saying. It's dead wrong. So these would explain why interventional cardiology procedures relieve angina, Now, intervention, again, they do something. They shoot dye in, see, visualize, let's say, what they would consider luminal plaque. So intraluminal plaque, that means in the lumen. And then they shoot a balloon in there, open it up, and maybe put a stent in. Okay, that's the angioplasty with the stent. Or more drastically, they take a saw and saw your chest apart. And then split it. And then they hold it back with these metal rods, and they hook your heart up to a heart machine that's about as big as half this room. And sometimes people mentally don't come out right after that, and it's and then they do all that, and then they bypass it, and then they sew you up. And guess what? It may relieve angina. Angina means pain. So this explains why interventional cardiology procedures relieve pain or angina, but do not reduce the risk of mortality or death from future heart attacks. So getting bypass surgery or angioplasty with stents do not decrease your chances of future death from future heart disease and heart attacks. You have to do something else, and that would be total body therapy, which is metabolic therapy. Weight loss, lowering your cholesterol by any means necessary. And there's different ways to do that, of course. There's some ways that are better than others. Some of the drugs aren't so good. But just for a point, that explains why lipid-lowering drugs reduce cardiovascular event rates, even though they do not dramatically improve coronary angiographic findings. In other words, you can lower the lipids with drugs or with diet, and you'll probably get some plaque reversal here, but it may not be enough to really see a lot, but yet you still have less death, better function. And that's because of collateral circulation, also small vessels. Because if you have plaque like that here, just think about the teeny tiny vessels at the ends of these larger vessels. Then you're going to have a lot of plaque, relative to the size of the vessel. And that's where systemic treatment, and of course that's what we offer at the American Clinics for Preventive Medicine. We offer systemic treatment and on a natural style, which is a lot better. And they also go on to say they challenge the 40 years of conventional wisdom that heart disease is primarily a plumbing problem. They used to think that to reduce morbidity and mortality by narrowing the lumen. In other words, by widening the lumen, I should say, but that's not how you do it. Now, if you go to the next page, and this is a great article, as you see, just to go down to the second paragraph, he says, I'm going to show you that 95 to 99% of all coronary disease, what it really looks like. And then dropping down to the last sentence of the third paragraph, most atherosclerosis, again, osis means too much of, sclero means hard, athero means artery. Most hardening of the arteries forms in the external layers of the artery wall. So if you look for the disease, or you look at the disease with the exercise stress test, if you look for it with an angiogram and they shoot dye in you, which both tests are really dangerous. When people come to the American Clinics for Preventive Medicine under our care, and I see someone who, let's say, all the risk factors, they have a family history, they smoke, they're obese, they have high blood pressure, not controlled, they have diabetes, not well controlled, high cholesterol, high triglycerides. Most doctors will say, well, good, let's go and get you on the stress test to see if we can see something. You may die on the stress test. Well, you feel pain? Good. Keep going, let's see if it registers well. I don't do that. What I do, I use the stress test after we're done with the metabolic systemic treatment that we do at the American Clinics for Preventive Medicine, and we show off with it later. We don't do it because the only reason you're going to do stress tests, you get some positive finding, then you're going to do a cath, and then they're going to do a procedure, but that is not the total answer. Rarely, you may benefit, like there's a widower's lesion, A Widorow's lesion is the left main stem is blocked, and that you probably want to bypass, because that's why they call it the Widorow's lesion. Okay, but otherwise, no. Okay, if you look at the disease with a stress test, if you look for it with an angiogram, you do not see the disease here, here, or here. And he was given a lecture, and he was pointing to ominous atheromas filling the external elastic membrane of an otherwise healthy 32-year-old patient whose heart was transplanted after her death in a car accident. In other words, they did a study on heart transplant donors. So somebody dies in an accident, and then they take out the heart to give to someone, and that's all good. But they studied them with this new method. They compared the angiogram shooting the dye in to these hearts that were just standing there, just sitting there. And then they did the new test, and that's what they did. For instance, the Titanic got to see 16% of the iceberg that destroyed it. As cardiologists with angiography, we only get to see 1% of the disease that kills half the population and 80% of all diabetics. That's not too good. You know, and meanwhile, they're putting another McDonald's in the hospital. That's suspect right there. The next paragraph, in autopsy evaluations of 262 heart transplant donors. So again, they looked at people who had died. Anybody see the movie John Q with Denzel Washington? Well, you can look at it and you can appreciate it. A lady was driving and she passed, and she was a heart donor because she wrecked. But anyway, hardening of the arteries was found by intravascular ultrasound. Now check this out. In 17% of donors younger than 20. Did you hear that? 17% of Americans under 20 years old have coronary artery disease. 17%. Is that something else? That's the third paragraph up. Yes, of course. And just a point in case, I know of a case of a 16-year-old male who was 185 pounds and had adult onset diabetes and high cholesterol. And he had a heart attack at 16. And remember the Vietnam veterans, and they did autopsies, and in their 20s they already had big plaque many times. Okay, and then 37% of us in our 20s have hardening of the arteries, 60% in the 30s, 71% in the 40s, and 85% of Americans in their 50s were found to have coronary artery disease by the intravascular ultrasound method. That's a lot, and it escalates. So, you know, so basically, this is a great finding. If you go to the third page, the two things that were most predictive of whether you had this particular type of plaque in the outer arteries was body mass index, and that's obesity level, and smoking. Anybody in this room smoke? Okay. Smoking is a particular lethal thing. It's not even cool anymore, right? So the way to stop smoking is to not smoke in your house, your car, or first thing in the morning. And to make it in your most undesirable activity list. When you wake up in the morning, put on your favorite dancing DVD or CD and dance, eat, wash up, and then go out and smoke. And don't let any children see you smoke, because as handsome as you are, you may influence them the wrong way. Okay. So house, car, first thing in the morning. That's how you do that. When you see patients at middle age with type 2 diabetes, they very likely have extensive atherosclerotic disease, regardless of the ancillary testing that they may do, like stress tests or angiographies. So basically, this is very interesting news. You can, the last sentence is stabilization of unstable atheromas is an attainable goal. And we see that in our testimonials alone. I'm going to pass some of these around, and here, and you can a couple.
Advanced version.
Right.
additional ones.
Right. So, yeah, pass those around. Yeah. And yeah, and you can look at them, and here's some for the back. Go on and pass it.
You can keep the black and white.
Yeah, keep the black and whites, return those. Okay, so you see, this is a big systemic problem. This can be reversed now without drugs. I want to say that. The reversal process that we use here is without drugs, and that has to do with our up-and-coming book, my manual, and it will be a major book, Reversing Heart and Artery Disease. And of course, it's naturally done. So this is an overview of this particular method. And this idea started really when I was holding the aorta, which is the major artery coming from the heart. And I was holding some guy's aorta at 3:30 in the morning, and it had busted. And I was so tired. And the surgeon said, "Richardson, stay awake." I mean, you know, can you imagine? I'm holding some guy's major artery, and I'm like dead tired, man. That's the medical. And so the nurses had to come and keep patting me and all around and make me feel important, you know. I'm holding this guy. Wow. And then when the surgeon bypassed it so he could replace it, I looked inside, and my God, it looked like gristle and fatty deposits and grease. I said, my goodness. So then I went to the library and got all these books. I said, what causes that? That is very, very deep. So I went and studied it, and I had a redhead, a beautiful redhead resident, because I was just an intern. And she said, I'm impressed. So that was positive feedback. So I studied and kept studying, and it led me to the research that I did at University of Alabama in Birmingham in the preventive medicine department. And what I discovered was that not only is hypertension, high cholesterol, but heart disease itself is reversible and treatable naturally. So we've established that it's an epidemic, right? And we've gone over some statistics. Now, we can also talk about who's really profiting from this. I mentioned that disease reversal treatment here at ACPM, it may cost a certain amount of money, say $4,000, okay? Compared to $130,000 open heart surgery, compared to a $60,000 angiogram, and it doesn't even do the job. That's pretty bad. So they got you coming and going. They got the McDonald's and the Chick-fil-A there at the hospital waiting on you, so you can order a double-decker Big Mac right after your open heart surgery. So I would say that their intentions are not all pure. Let's just put it that way. And therefore, the people making a lot of money from this include certain big business, cigarette companies certainly, the meat industry, the dairy industry, the fast food chains, and those types of things. Then on the other end, who do you think is making greater profits? The hospitals, the doctors, and I should say the surgeons, or the drug companies?
Drug companies.
The drug companies. And, you know, I'm not an economics major at all, so it's hard for me to even conceive of this. But then I kind of got the idea when I was an intern, and they sent a real nicely dressed drug reps to convince me, as a new doctor, intern, to give and write and prescribe, was it Benedictine to pregnant females, because it was supposed to stop the nausea and everything. And then 6 months later, after those nicely dressed people came, there was a bulletin, and it said, "Oh, stop giving that drug because it causes birth defects." I said, well, it'll be a cold day, and you know what, before I listen to some drug reps, I just laugh at them. Yeah, what do you have now? Yeah, okay, right, because that was a night, that burn isn't going to happen again. And then, of course, they get you in the hospitals, and and I think we built a major industry. It's almost unstoppable, because if I'm able to demonstrate, which I've demonstrated, you can see in the testimonials, of disease reversal for a few $1,000s versus $130,000+ dollars. One man had not one, not 2, but 3 open heart surgeries, was on 7 drugs. Couldn't walk from here to the end of that, to where the door is on the street without getting the chest discomfort, like Red Fox, who he did Sanford and Son. Now, they say I look like, who do I look like in Sanford and Son? Yep, that's what everybody says. And Grady was handsome. He was a nice guy, so I am not ashamed. Yeah, but in Red Fox, he did reach his demise by a heart attack, and my father as well, you know, and he was even a physician, so he didn't get it, but he was a great physician. But I am taking it on another style, another more natural wave. So what we're going to do is go over the particulars in this particular class. This is just the introduction. I want to make sure that I cover everything. Like I said, the basis of preventing and reversing heart disease, of course, medical management. Now, I've known some people to come to my clinic and they really want nothing to do with the medical profession to a fault. And they probably needed to take temporarily some anti-pain drugs, and that they should have done, let's say, because they didn't make it to their first chelation therapy. So, you know, you have to know when to say when. But really, everyone gets off of the drugs. And I work in, I won't mention the hospital, but I work in the North Georgia mountains. Beautiful area, beautiful hospital. You should see the people who have coronary artery disease, person after person after person. And diet is a very important factor, and the diet should be a 10 or 15% fat diet. Dean Ornish has proven you can reverse heart disease dietarily. Exercise is a mess, but you may start slow. You may not want to do a stress test level exercise right away. You have to earn that right, so to speak. I have a patient I was exercising in the park with because I do kickboxing, and I was teaching him that, and he's about, I guess he's about 150 pounds overweight, and he's already lost about 100 pounds. And he has had a clean diet for some time and everything, so we were able to get his heart rate up. But if he was on an unclean diet and some other problems, he could have had a heart attack. See, so you have to earn that right. Stress reduction, excuse me. Dean Ornish has put out a book about having a good spiritual family life and all that sort of thing. That's important. Don't argue with your wife. It could be your last words. And herbs and nutritional supplements, we have some mastery over that. The herbs can pull the cholesterol out of the body and help. Just about everyone, 90%, 99% of people who come through, they may have cholesterols of 296. We get them down to 146. We've had people with cholesterols of 360, 410, and we get them down to normal with the disease reversal methods. And we school people how to do it. We put the supplements in there to help allay some of the symptoms and pull it down. We have excellent supplements for hypertension too that we found, some Chinese ones. Smoking and alcohol and caffeine cessation. Smoking cessation is a must, just make up your mind. And intravenous EDTA chelation therapy is a must for heart disease because what it does is reverse hardening of the arteries by pulling out the lead and cadmium out of the matrix of the plaque, and thereby helps the plaque resorb into the body. It also opens up, it's been demonstrated to open up the vessels. And all you need is a little bit of opening for the blood flow to increase exponentially well. Because you have 60,000 miles of blood vessels in the body. So if you just open all of them up, that blood flow is going to flow like a pulse, much, much better. When you add chelation therapy to dietary manipulation to the herbs, you have a synergistic effect of almost, from my eyes, pretty close to 100% cure rate for heart disease. And that's bold to even be able to say. So that's with that chelation therapy and all the other methods that we do. All right, let's see now. Some of the problems with surgery you have to understand. You can have botched blood transfusions. You can have dysfunction of machinery. You can develop psychological or mental dysfunction and heart dysfunction. And sterilization results in faulty sterilization can result in 100,000 hospital infections, and that's not pretty. And about 20% of hospitalized patients check out with 20% check out with diseases that they developed within the hospital. You know, so this is all true. So I just wanted to bring this to everyone's attention. So we are going to be giving these talks. I think that's a good amount of information you have that you can spread the word. This room hopefully will be filled. We'll be sending out information when we have these type of talks, and you're welcome. It's our giving back to the public, and we just have a earnest to do that. Now I'm going to open this up to questions at this time. Yes.
If you don't do the stress test, what do you use to measure how bad your heart disease or plaque is?
Right. Well, actually use mostly functional aspects. For instance, if someone comes in, I can look at their eyes and be able to tell usually how much plaque they have. Either looking behind in the back of their eyeballs at the retina, because you can see the blood vessels, and also externally in the iris. So knowing the statistics, if someone comes to my office and they're 55 years old, they have an 85% chance right there of having significant plaque. Then if you add that high cholesterol, high blood pressure, obesity, diabetes, any of those, then it just goes up. So basically, and if I see if I see rings in the eye, certain rings in the eye, if I also see back in the vessels, plaque evidence, then that's my evidence there that I treat it aggressively to prevent future woes. Because where do you think Alzheimer's comes from? It comes from partly plaque impeding the function of the brain cells, and then they become degenerate, and then they accumulate the amalgam. No, not the amalgam, amygdaloid, sorry, in the cells. And then they collect the heavy metals. With chelation, you pull the heavy metals out. The newest drugs for Alzheimer's are going to involve things that dissolve the plaque within the cells, and they bust out the heavy metals, and then chelation will pull that off. That's going to be really hot treatment. So, and it really depends on the age of the person, the diet, the other health problems, whether I make a judgment that they could benefit from cardiovascular disease reversal. Yes?
What is chelation?
Chele, C-H-E-L-E, is a Greek name that means claw of a crab or lobster. So, chelation therapy is using a man-made amino acid, in this case EDTA, which stands for ethylene diamine tetraacetic acid. Okay, and you know, if you want to learn to say that, say supercalifragilisticexpialidocious, is all I'm saying. You know, but anyway, what it does, you inject it in the body in an IV over 3 hours, along with magnesium, vitamin C, B vitamins, and other various constituents. And what it does, it lets the magnesium go, pushes the magnesium in the cell, and pulls calcium out of the cells that surround the blood vessels. And it actually shoots calcium in the bone. So it pulls it out where it's not supposed to be, the joints and the arteries. And not only calcium that shouldn't belong there, it also pulls out cadmium, aluminum, lead, and flushes it out. Flushes it out through the feces and the urine. And that's what chelation does.
One other question.
Certainly.
I'm not medically inclined here, but some of this stuff says angiogram.
Right.
Some said angioplasty. What's the...
Well, angio means vessel. Gram means picture. So when they do an angiogram, they shoot dye in the vessel and then take a picture to see if they can see blockage. Okay? Angioplasty means that, oh, we see blockage, then they're going to send in a balloon and they'll inflate the balloon and push the plaque to the side. That's angioplasty.
So angiogram is just a diagnosis.
It's right. And angioplasty is a treatment, and then they can put a stent in there to hold it back. And now they can put even a medicated stent. And what? Yeah, they have medicine there that does something. Yes, a medicated stent. And what I'm saying, yeah.
You're saying that this plaque that's in the artery wall can be removed?
It can be removed, but not by angioplasty or stent, because that's only to remove the one that's in the lumen. The lumen is the opening or where the blood flows within the blood vessel. That other plaque has to be removed by systemic treatments, which treat the whole body.
So you can't get it out?
Yes, that's what the last statement says on the article. The last statement says, stabilization of unstable atheromas is an attainable goal. And then the natural history experiment showed that extraluminal plaques regress by as much as 2 millimeters, which is a lot when you're dealing with vessels, when atherosclerotic heart donors were transplanted into recipients without atherosclerotic disease. How many people actually understand that? Okay, you do? Okay, one person. In other words, they took diseased hearts and put them in people, let's say maybe they had a valvular heart disease, but they didn't have coronary artery disease, and they just had a bad valve. And they replaced it in those people, and the heart, the thickening or atheromas or all that plaque disappeared when they put it in someone who wasn't prone to that type of heart disease. They had another more structural problem, like a congenital heart disease that they were born with, and the valve was messed up, and they were waiting all these years for a heart transplant. And then here somebody's a smoker, they have high cholesterol, and their arteries are diseased, and they put that heart in the person who only had a heart defect because of a malformation.
Everything went okay.
And then the disease in the heart actually reversed because their bodies were cleaner. They weren't smoking, they didn't have high cholesterol and all that. So it reversed. Now, if you take a smoker and someone with high cholesterol, why not reverse it within their body, and then they can reverse their own artery disease? And that's what we do with the disease reversal program that we offer, as well as the chelation therapy. And when you add them both together, you get almost 100% cure rate of heart disease that I've seen, that I've observed in my practice.
They don't think outside. They're still, like you say, doing this shoot you with the dye and all that.
Yeah, they look at it differently, but they are good at putting new McDonald's in their hospitals. That's it. They're really good at that, because that's the bottom line, money. And then it's a revolving door. I was thinking about opening up a drug rehab and then putting a bar next door. When you get out the drug rehab, you get a free ticket to the bar, and then we'll have a pile of, 3 free drinks when you get out the drug rehab. But basically, that's what they're doing. It's pretty pitiful, don't you think? They don't have the guts to stand up and really look at the data appropriately. My question is everybody doing their job? Me and my brother were discussing that. And of course, nobody's perfect. But that's how it is. Be ready to begin. Good evening, everyone.
Good evening.
Thank you for coming out. This is my healing center, Dr. Richardson's Healing Center, and in it we have meetings like this and get people on programs. We have DVDs, a lot of educational materials. We do a lot of research up here too. And today we are going to talk about the philosophy behind the reversal program for heart disease. Now, philosophy is important to me. It was a good subject in school to me, right next to calculus. Ken and I went to Pitt together, and then my brothers came up after us, and Ken was a great philosopher too.
Back at you.
Okay. So we're going to talk about this philosophy, and I'm going to just highlight it by saying first that we're going to talk about what we want you to remember out of this. So we're going to go over points of that. The keys to successfully overcoming heart disease. The keys. And reprogram your mind to accept the treatment, so to speak. And having a positive and victorious mental attitude about the program. That's why we get into philosophy. Last week we did an introduction, and we came up with the conclusion that 85% of people can, John, can you check the air conditioning? 85% of people in their 50s have hardening of the arteries. That's a lot of people. 71% of average Americans in their 40s have hardening of the arteries, and 60% in their 30s. So most of us do have hardening of the arteries. So what we're talking about is how to reverse it. And so we talked about the stats last week. You remember about 1 million people have sudden death every year. So, you know, there's all those sad statistics.
They were just talking about that. They were
Really?
talking about people dropping dead,
Yeah.
silent, in their sleep, after work.
Yeah. So what we want you to know now, the good thing about the treatment that we're using, in fact, I just had a gentleman who heart disease had virtually disappeared. He had drugs on. He had a patch on. How many know what a nitro patch is? Mm-hmm. Yeah, and several other drugs. And his blood pressure dropped while he was trying to vacation in Puerto Rico. And, you know, that was because he didn't need the drugs anymore, and they were poisoning him, because all drugs are poisons with desirable side effects. And I said, rip those drugs off of your body. You are free. You do not need them anymore. And he was extremely happy about that. Also, you know, why should you even bother to do the treatment? Because you have to change your whole mindset to get into this. You have to think differently. And sometimes that can be painful to go against the grain. So the truth of the matter is you will almost instantly feel better physically, mental clarity. You'll have more energy when you do the reversal diet, the whole philosophy behind this of why doing it. It's easier to go and not worry about changing things. It's easier just to do the same thing you've been doing your whole life. You know, go to Checkers. You know, it's like the ad says, you gotta eat. And you know, so you don't, no forethought, you just all of a sudden you're hungry, and then there's a Checkers, you go right in there, bam. That's almost like using a prostitute. But anyway, the diet is very varied, creative, and delicious. Okay, do you believe that? Most people, if you think you're going to get on a diet plan for heart disease, oh gosh, who wants to do that? Take you screaming and I don't want to go. But if I can get you there, you're going to be like, what was I doing before? This is so good. So it's a philosophical thing of why even do it. Why go through the pain of the threshold? Okay? It's just like getting off of hard drugs. You may so-called feel good injecting it, but then you may have to go through a weekend or two of hell, but then the benefits afterwards are much greater than the hell you go through. Same from the withdrawal from the typical traps of the food in the Western world. Okay? This diet is rich and powerful. I'm going to give you an example. They did a study in the Discovery Channel, and they took about a dozen humans and had them live around gorillas for 2 weeks. And the study was that the humans had to eat all that the gorillas ate to the best of their ability. And in proportion, because gorillas eat 50 or 60 pounds a day, so the humans had to eat about 11 pounds. Now, when's the last time any of us have eaten that much food? These humans were vomiting, a few of them, because they couldn't keep up with the volume of food. But when they were done, their bowels were moving well, I guess. So everybody had lost who needed to, 20 pounds. I would probably gain more weight because I'd be doing my push-ups. And everybody's cholesterol dropped about 40 points in 2 weeks. So I guess we can just say, eat like a gorilla. Now, you know, can you imagine your doctor saying, you know, you kind of look like a gorilla compared to a dog. You should eat like a gorilla. Have a good day. Well, what else do I get? No drugs? No, that is the drug. Eat like a gorilla. I'm serious. You went to all that school to tell people to eat like gorillas? So I have to sit back and think about what I'm doing. You know, well, you know, oh yes, eat like a gorilla. Is that better? What? You know, so the health will improve, the blood pressure will drop, the cholesterol will drop on this program. Cardiovascular symptoms will fade away. Dean Ornish proved that. Dean Ornish, how many people have heard of him? From Sausalito, California. And basically, he proved that with diet, you can reverse heart disease. Now, it wasn't as dramatic as we get with diet and chelation at all. Chelation seems to like melt it away. And guess what? You lose weight too. I saw one of my patients today. His initial blood pressure was 220 over 120, and his weight was 260. Now his blood pressure is 140 over 80, and his weight is 212. I'd say that's an improvement. And he's happier and he's working out. And guess what? Your taste buds will adjust. Now, don't be like some of my patients and they go to their family reunion and they fall off the wagon. Why? Because they didn't take the time to think, philosophize. I'm going to the family reunion. You have to bring with you your own aura of influence, almost like a force field. And that force field will be some greens you make, a sweet potato pie, or something you're going to contribute for the family. The only thing you have to worry about is them eating up all your food as an appetizer. Then they have all their food to eat, and then you're out of luck. Okay? Now, the keys to successfully following the program. Remember, the goal is restoring your health by any means necessary. So you have to be open-minded. Okay? How many people thought at some time in their life that barbecue food was really good? All right. And do you know that smelling barbecue smoke can give you lung cancer? That eating barbecue meat has as much oxidants as smoking 300 to 400 cigarettes? I was driving by a barbecue place. I saw that lethal smoke coming up. I told my children, I said, see that smoke? Don't even breathe it. It's a shame, you know? Yes?
Does it matter if you use like natural charcoal or charcoal made out of true hardwood or something?
I'm sure it's better. Probably smells a little better, but once that flesh starts cooking, it produces those types of chemicals. It's like saying, is it better to eat organic turkey or chicken? And it is, probably. It's probably better to eat an organic human if you're going to, but the thing is, then the turkey that's organic, I heard it's so appreciative of you feeding it organic food that when it's time to slaughter it, it willingly lays its head down on the block for you to cut the neck off. You may need some support. It sounds like you do. You know, for compliance to the program. Now, my brother and I, we used to go to Aunt B's house, and she would have a layer of food that was out of this world, I guess to them anyway. And then, of course, my grandmother's fried chicken and chocolate cake. And I told my grandmother, I wanted to be honest with her, so I came home and I said, Grandma, I can't eat that anymore. I can't eat your fried chicken or chocolate cake anymore. She was hurt in a way. She said, Richie, she said, you growed up on it? It did you good? It didn't hurt you? I said, Grandma, it's a philosophical reason. Because eating one piece to make her feel good would be okay. But that would be like a junkie doing one more piece of drug to make his friend feel okay. It's a philosophy thing. Yeah. It's the philosophy why. And I may feel like I'm depriving myself at that moment. but then I have to reward myself in other ways. So you really have to look at this philosophically. So when you go, I remember their section used to be large, and then they prepared me a little food, and it was in a little corner. Every year my corner got bigger, and at the end their corner was a little tiny corner and my corner was bigger. You were right, Reggie. But I held to that philosophy, and I've seen people fall off the wagon by going to family reunion, but that's when you have to pull things in, like philosophical attitude. Why even do it? I've had diabetes reverse, people with sugars of 400. In fact, I was challenged at University of Pittsburgh when I was at a clinic there. And I didn't tell my bosses because I knew they'd be too scared. And they said, well, the patient told me, he said, look, my sugar's 400. I don't want any drugs. And I want you to figure out how to get rid of it. I said, wow. So that's when I wrote my first diet plan, way back then. And it worked. It worked. Okay, so you also have to be well studied on the program, and that's one thing that makes our cardiovascular disease reversal program so different, is that we educate thoroughly. So, because people are going to throw things at you. Are you going to get enough protein? You get more protein from dark green leafy vegetables per calorie than eating flesh. So of course you get enough protein. We have an exercise man right here, a teacher, a PE teacher, and a very great one, and a great example of one as well. And you know, I can tell you I've gained 10 pounds eating this type of diet by doing exercise. My friend introduced me to a guy named Khalil, who's 244 pounds of pure muscle. Pure muscle.
You're vegetarian.
Yeah.
Wow.
Yeah.
Looks like a linebacker.
And some, no doubt. And then you'll find some family that love you that won't support you on the program for various reasons. Number one, you make them feel guilty. Number two, that means that they have to actually think about it. And how dare you making them have to think. So you have to philosophically think about it. That's why this session is on philosophy. Why sit there and deprive yourself? I was fasting in medical school for 4 days and 4 nights on water. And I decided, part of me wanted to stop the fast, and the best way to do that was call my grandmother and say, Grandma, I've eaten nothing but water for 4 days and 4 nights. Boy, you better eat some. Get you some potatoes. I said, okay, thanks. But, the thing is like, why would you deprive yourself of water of food and fast like that? Now, that would be a bad idea for some people who aren't prepared on certain drugs. I'm not suggesting that necessarily now. But then why deprive yourself of certain things that you're used to? I'm going to tell you why. Because you have to think higher than your brain. You have to use philosophy to think higher than your taste buds, what you're used to. Also, anybody see the movie What the Bleep? What the Bleep showed that you have pathways in your brain that are rewarded when certain things happen. Like, every time I meet a beautiful woman, hello, ma'am. Oh, you're the beautiful woman. And yes, and then I just happen to drop the tray of food. Oh, I'm so sorry. Oh, gosh, let me clean it up. Oh, this happens every time I meet a beautiful woman. It wouldn't be right if it didn't happen, because when it happens, there's neural pathways that get rewarded by that embarrassment, by the shock, by the tray. So you have to, when I meet a beautiful woman, it's like, you have to meditate and resist the tendency to, oops, do it again. It's like that. So you actually have to fight the pathways in your mind and get other pathways formed. And the only way you can do that, that's why they call us Homo sapiens sapiens. That means we think a lot, and we have to use our brains to overcome the tendencies to eat certain things. Also, physiologically, when you eat certain things, enzyme pathways are generated within the GI tract that are distinct for those particular foods. So if you're used to getting proteins, let's say from flesh, for instance, you are going to feel weak initially when you don't get flesh, because you're not going to have the enzyme pathways set up to get all the protein from the leaves and the beans and stuff. So maybe a few weeks that you just do that.
So my twins, when I go past Popeyes, it's nothing like normal.
Yeah, I remember I was walking on Peachtree Street and I was eating meat very sparingly, but I walked down and all of a sudden I'd want some chicken. I'd say no. It was my philosophy why I didn't do it. That's it, because my body wanted it. I'm like, my God. Okay? But what physically helped me is getting excellent protein from smoothies and things like that. And that seemed to physically help. Sometimes we need help physically. But it is a philosophical idea of why take a stand, why be different. There's points where there'll be ups and downs to that. There's some points where you'll be treated like a demigod or like somebody very important, so to speak. At other times, you'll be like an irritant. Oh no, I don't want to think about, because they don't want to think about what they're doing. They want their comfort zone. Because when you get out of your comfort zone, it can be painful to the mind, and sometimes all you have is philosophy to take you through there. And that's what we're talking about. And let's see, I want to tell you, the diet does make you well. You eat as much as you want. You don't have to count calories at all. So, and that is something that's beneficial, because then it becomes effortless to do it. You don't have to think about it too hard. So that eases some of the pain once you have committed yourself and get the hang of it. You need a total commitment. If you're trying to reverse heart and artery disease, it needs to be a total commitment, because you need that strength, you need that impeccability. It's like if you have fatty liver disease or hepatitis C, you just do a little alcohol. All you need is a drop and it flames the liver up. And then one drop can lead to another drop, or one piece can lead to another piece. And then you need something to break that cycle. And some people may go to me or go back to me or some other things. But we try really to make it so the cycle is not broken, because we want people to be free. Like I tell people, philosophically, when people come in to see me, to the best of my ability, I want to make it so you don't need me anymore. I hate people strung out and dependent on me. Oh, doctor, I need this, I need that. I want you to be self-sufficient. Now, why would I do that? That's going to cut down on the bottom line. I don't worship money. That's not my philosophy. We all need it and we want it, but I'm not going to worship it. And, my practice is generated, the philosophy of my medical practice since I was a child. There's 3 reasons why I'm a doctor, and I need to perfect them, of course, because I'm still, like my wife says, I'm in, we're all growing. To help people, to make a living, and to deal in science. So, but you got to keep the edge on helping people, because you don't want to put, but you need money. You can help people and then you won't be around to help them if you don't have any cash. And then on the other hand, science has to be understood and dealt with. There's things I see in my practice because of philosophy, because I keep the philosophy pure, that other doctors haven't seen. There's theories that I get to see evidence of that aren't written in any textbook, because nobody's thinking. Philosophically, is it logical to have a McDonald's in the hospitals at all? That's bad philosophy. That's the philosophy of greed and stupidity.
Have integrity.
And lack of integrity. Anybody see American Gangster with Denzel Washington? You saw that too? Denzel's a great actor, isn't he? Yeah. He can play the gangster or the good guy, can't he? Very convincing. I don't know which he plays better. But anyway, long story short, one of the main actors, young man, busted Denzel fair and square, and Denzel said, "Okay, who do you want? You want me to give you the mafia so I can get out of jail?" And the guy said, "I'll take them too." And Denzel said, "No, you don't want your own." The guy said, "Yes." He wanted his own. 70, and this is based on a true story, 75% of the narcotics squad in New York were corrupt and busted fired and jailed. So there's going to be plenty of heroin on the street. And there was. You know, so that's the wrong philosophy. We have wrong philosophy. We could have been had cars